In this lesson, we will learn a few issues that can arise when booking appointments for patients. Let's just book or test patient. As you can see here, an alert comes up. It says no show 3 times. So this patient is not allowed to make an appointment at a clinic. They can only come as a walk-in. Assuming they come as a walk-in, you would add the patient into the schedule, and you would see that after the last name it's written no appointment. If this patient would book an appointment, you'd have to politely tell them, sorry, you can only come as a walk-in. At times they would book an appointment online, and if that happens, you'd have to contact the manager to ensure that their appointment is canceled, as for various reasons, usually because they did not show up to previous many appointments. They're not allowed to book appointments at our clinic. Another issue that can arise is that the patient has an outstanding bill. If that happens, what you would see at the end of the last name would be pay, and so in the schedule, this is how it would show up. In this case, that means that the patient has an outstanding bill. They're not allowed to see a doctor prior to paying this bill, and you'd click onto invoice list right here in order to see what bill is outstanding. Another item that can arise is this one called PRV. PRV would mean that this patient is a private patient. Private patients are usually from out of the country. They can also be from Quebec. Quebec is considered patients from Quebec are not covered by the provincial health system, so they need to pay privately, as well as patients whose care cards are not valid, or other patients considered privates are patients who do not have a valid BC care card, who are from Alberta, and who do not have the actual card. Patient needs to show you the actual card of their out-of-province card, and you must look at it to make sure that it is actually valid. There will be a date on it. If there's no card can be shown, or the card is invalid, those will be considered private patients, and you'd have to put PRV after their last name as such. Something else that can arise is called fired from clinic. So these would be patients that for various reasons have been expelled from the clinic, usually verbal abuse of staff, etc. So in this case, actually, you do have to be a little bit careful. Some patients can be verbally aggressive, especially when being told that they can't see a doctor. So you might want to call security if this comes up. The phone number of security is always at the front desk. And again, just be careful. The last item that we will take a look in this example is if CL19 is written after the last name. CL19 is an ICBC item, so a patient who has had a car crash and is covered by the ICBC provincial car insurance. Sometimes the CL19 form is asked to be filled out, and it's important to remember that this form is at the front desk. So if such a patient would come up and CL19 is after the last name, then you would take the form from the folder in the front desk, and as you put the patient into the room, you would also bring the form for the doctor to fill out. it is important to remember that there's a certain time importance in terms of getting the form filled out, and that's why we want to make sure that a patient, when they're called back, so the CL19, that the actual form is filled out. Once the form is filled out, you would have to scan it in, and also you would have to fax out the CL19 form, and the fax number is on the form. So again, if CL19 is after the last name, keep in mind that there's a little bit of paperwork to be filled out, and there is some faxing to be done. So this concludes this example.